For a lot of Texans without insurance, health care options are sometimes pretty limited. The local hospital and a health clinic working to try to provide medical care to the uninsured. Lauren Petrowski's over at St. David's to tell us how they are surviving the system. Hi, Lauren.
Good morning, Joe. Well, each month, thousands of people come to this ER for non-emergencies. Many of those people don't have insurance, and that's why community clinics have such an important role. They provide the uninsured with a medical home, a place to go for regular visits, and a place to keep them out of the ER. Patty Geringer is seeing a new physician for the first time.
It'll be affordable to me since I am unemployed.
Several months ago, she lost her job and is without health insurance. Patty has heart problems and, like many in Austin, bad allergies.
It's a very scary thing when you don't know where to go and you have a lot of health problems, and especially when you're new to an area.
Instead of going to the emergency room to see a doctor, she made an appointment at the Ben White Health Clinic, a community clinic operated by the Lone Star Circle of Care. Since opening in April, the clinic sees about 900 patients a month. Roughly 50% are uninsured, the rest underinsured.
Not just somewhere they can go for an acute need, but somewhere they can go to get basic ongoing primary health care, just as they would in a private physician's office.
That was the goal in opening the clinic right next door to St. David's South Austin Hospital. Many of the patients visiting the clinic previously went to the ER for non-emergencies.
So the premise of creating accessibility has worked in that regard, in that those patients are receiving their follow-up care in a more appropriate setting.
St. David says that about 6,000 people come into their South Austin emergency room each month, and of that number, at least a fourth are uninsured. However, even with the opening of the clinic, as more Texans lose health insurance, the ER at St. David's is actually seeing an increase in visits.
There still is a great need for access to that care that is being used in the emergency room.
Clinics like this one are in great demand, and while Patty searches for a new job, she's glad she has an option for health care.
When you're going through enough stress in life, you don't need another added, like I don't have a doctor, I don't have a place to go, and I'm sick. Where do I go?
So St. David's actually provided a $600,000 grant to get that clinic up and running, but definitely more are needed in this area. And if you want to share a story about surviving the healthcare system, you can email me. You can find my email address on our website, myfoxaustin.com. Joe?
Thank you, Lauren.